I'm going to turn it over to Glenda from Health New England.
Great. Thank you, Claire. Good afternoon, everyone. Excuse me. My name is Glenda DeBarge. I'm the Senior Account Executive here at Health New England. I appreciate your time this afternoon. I first wanted to start with some information on Health New England. I've actually been at Health New England for 20 years now. Next month will be my 20-year mark, and the GIC account manager at Health New England for almost 18 years. Health New England has been a GIC option since 1988, so we're fast approaching almost 40 years with being one of the options under the GIC. Our headquarters is located downtown Springfield at 1 Monarch Place. We're located on the 15th, 16th, and 17th floor. We have two plan offerings with the GIC. One of them is an HMO regional plan, and this plan is for actives and/or retirees without Medicare. The second option that we have is for retirees with Medicare Parts A and B, and it's our Medicare Supplement Plus plan for the retirees. We have approximately 25,000 members in our active plan and about 4,400 members in our retiree plan. And if you're familiar with the benefit decision guide, I'm sure you've seen the maps that are in there kind of guiding members as to which plan would be best for them. The GSE wants to make sure that you have adequate coverage. So for our HMO, Health New England's HMO active plan, you do have to live within the 5 counties of Western Mass to be eligible to join the plan. So Berkshire, Franklin, Hamden, Hampshire, and Worcester counties. You do have to have residents in one of those counties to join Health New England's HMO regional plan. Then for the retirees, you can live anywhere in Massachusetts and choose a Medicare supplement plan, and the network is as long as the provider is contracted with a Medicare provider. So you notice there's a couple of maps in the benefit decision guides that have the counties and which plans are available within those counties. I highly suggest everyone reference that because it's a really great guide, again, to make sure that you have adequate coverage. This is a list of our in-plan hospitals. So while I stated that our network, or you have to be in the 5 counties of Western Mass, these are the hospitals that you have access to in our provider network. Okay, so I want to touch on the active plan that we offer with the GIC. This is an HMO plan. You do have to utilize Health New England's providers to get coverage. So with any HMO, any service outside the service area, you do have to get prior authorization. So on this HMO, you do have to select a primary care physician, but I do want to reference that there are no referrals on our plan. So as long as that specialist is in network with Health New England, you can go ahead and make that appointment. It is different from prior auths, as I mentioned earlier. That is an authorization for you to seek care outside the service area. So that is different from the referrals that I referenced, where Health New England does not require referrals to see any in-plan specialist. So to touch on the services or the plan design, as you know, most of the plans with the GIC have a deductible. Ours is at the $400 level for individuals and $800 for family, and it's a policy year deductible. It runs July 1st, 26 through June 30th, 27. Any preventive care is going to be covered at 100%, zero cost to you as a member. I believe all the plans have this preventive care coverage 100% in full. When you seek a primary care physician visit with Health New England, it's a $20 visit copay along with urgent care. So we do not tier our PCPs, and so you'll notice that's one difference with Health New England. The only we do tier specialists, so you'll find that there's a tier 1 $30 specialist copay and a tier 2 $60 specialist copay. So the tiering is based on academic medical centers, and the only one that we have in our network is UMass. So basically, any specialist that's associated with UMass Memorial is going to pick up that $60 tier 2 copay. Everyone else, all the other specialists, are going to be at the $30. We'd have an annual eye exam at $20 a copay, also one per every 24 months. And then these next services, high cost services, emergency room, lab work, inpatient and outpatient services, they will all apply towards deductible with their respective copays. $100 copay for emergency room after deductible, $100 copay for high cost imaging like your MRIs and CT scans after deductible. Lab work is covered at 100% after deductible. When you have an inpatient admission, it's going to be $275 copay after deductible. And then outpatient surgeries are kind of split up into two copays. So the 150 would be any GI or eye surgeries that are done at a freestanding facility. GIC wants you to benefit from a lower copay if you visit a freestanding facility versus a regular outpatient facility, whereas your copay there would be $250. As you know, CVS Caremark is the PBM, the pharmacy benefits manager for the group insurance commission. And I just wanted to highlight the deductible $100 individual, $200 family here with the retail copays at $10.30.65 and mail order at $25.75, $175. You will have separate IDs from Health New England and from CVS. And then also wanted to highlight the maximum out of pocket. Now this looks like a daunting amount at 5,000 individual and 10,000 for family, but this is basically a safety net, which all the plans have, that requires us to keep track of your out-of-pocket costs. So it's very difficult to get to these amounts, but you'll find that if you do have services, all those will be applied towards this maximum out-of-pocket. If for some reason you get to that 5,000 amount, you will no longer pay for services for that policy year. And again, it's a very, very difficult amount to get to, but all plans must have a maximum out-of-pocket in play. So that, again, includes all your out-of-pocket costs. Just briefly on the retiree plan. So this plan, I also want to mention that the active plan is also available for retirees without Medicare. So early retirees will be able to remain on those plans. Once you are 65, retired with parts Medicare A and B, you will have the option to select Health New England's Medicare supplement plan. So I believe the GIC will contact you before you're 65, but a couple months before to give you your options as a retiree. So this works with Original Medicare, where we are the supplemental plan that covers anything, for example, like your Part B deductible and co-insurance piece, and these would be your out-of-pocket costs. So there's no deductible on the plan. Preventive care is covered with no copay. You do have primary care physicians or physician office visits at $15 for both PCP and specialist. You have an emergency room visit at $50. And then for high cost imaging, lab work, inpatient hospitalization, outpatient surgery, member cost is no copay. And again, for the retiree plan, Silver Scripts will be your benefit, a pharmacy benefits manager. And there's no maximum out of pocket for this plan. I wanted to highlight the member portal where you have resources available to you to review your benefits. Actually, some of this doesn't apply to the retirees, but on the portal, you'll be able to change your PCP, view print or order ID cards, check your claims history, especially with your deductible information, submit inquiries to member services, search providers, and then fitness reimbursement is also available online. Well, the paper version is online to download and print and submit to Health New England. But one thing I did want to mention is that through this portal, you will not be able to change any of your personal information. I believe that has to go through my GIC link for each member because the information trickles down to Health New England from the GIC. So we receive two file feeds, Tuesdays and Fridays for enrollment, and that's where we'll apply all the changes to our system. So if your personal information changes, your address or a name change, that gets sent to Health New England, and then we process the change with a new ID card accordingly. So just keep that in mind as you will not be able to make those personal changes on our portal. This is a picture of both our ID cards. So you'll have the active HMO members on the left-hand side with the GIC commercial plan, and then the retiree one on the right. We will receive the open enrollment file from GICA, but I believe by the end of May. And in June, everyone, existing members and new members, will receive ID cards in the month of June. This is just a quick snapshot of our portal. So Health New England health.org/GIC is our microsite for GIC information. Again, here is where you'll have access to the member portal. The wellness reimbursement form is located here, and you'll also have information on various communications from Health New England. One thing I forgot to mention about the portal is that when we launch our new website, explanation of benefits when you have deductible services are no longer mailed to folks. So there's a couple ways that you can obtain your EOB, and that's one, through the portal. So you can view the claims history on the portal. Two, you could call member services and have them send you a copy of the specific data service for the explanation of benefits. Or three, you can opt back into paper copies being sent to you. So you would essentially get an explanation of benefits whenever you receive services. So those are a few ways to get those copies over to you, but I would suggest doing that online if you can. I also wanted to highlight today, I had a couple of open enrollments yesterday and today, and I always want to mention that Teladoc is a program or a vendor that we've contracted with. So you have telehealth visits available to you with your providers today, with your doctors today. Sometimes you have them in the office, or sometimes they'll schedule telehealth visits with you. Teladoc is another network of providers that you have that are available to you once you register 24 hours a day, 7 days a week, 365 days during the year. So this is available to you at any time. You do have to register first, and you can do that with your member ID number through the member portal. I had a colleague that was, as you know, stuck at the airport just recently, and she wasn't feeling well. She was actually feeling really, really awful, and had a Teladoc session at the terminal for her. And by the time she landed back home, she was able to get, antibiotics for her sinusitis. So this is a really great tool for you if you don't want to take time off of work. You could schedule time after hours in your, comforts of your own home. And you could, the best way to do that would be, again, to register. And also when you're traveling outside the service area, is a great way if you don't know where the nearest urgent care is. And again, it's for non-emergency medical conditions like cold and flu symptoms and bronchitis and dermatology issues, those type of things. So I always like to highlight this as, reminding existing members and new members joining. This is available to them. This is a copy of the wellness reimbursement that we offer through Health New England. So you can get $150 per family per calendar year for all these type of activities, community farm share, athletic events, if you have kids in town sports, bike shares, nutritional apps, fitness equipment, and gym membership. So this is a reimbursement that's available to you every year. And you actually have March, I was telling everyone today that were existing members, they have till March 31st today to submit for the previous year. So you would have a 3-month grace period every year if you forgot to submit for the previous year. So folks today that I spoke to actually can fax their information in, get the reimbursement for 2025, and then tomorrow, if they'd like, they can submit for 2026. You do have to fax in your receipts, or I think also you can email this if you can scan your receipts in. And this again, I'm sorry, these are the activities and programs that you could get reimbursed for. Okay. And this is our member services line, 413-787-4004 or 1-800-310-2835 if you have any questions. If you are inquiring about GIC plan, please let them know that your prospective member joining the GIC as of 7/1. They'll be able to triage your calls, and they're open Monday through Friday from 8 to 6 p.m. And you can also email them at memberservices@hne.com. That's it.
I will unmute here and Linda will.
Okay, I'm going to start with a question that someone asked who was unable to attend today. And it's about the hospitals. The only hospitals that are not shaded are the ones in Western Mass. Does that mean that you cannot go to a hospital in Boston? What if
The
you
only,
okay.
oh, I'm sorry.
And then what if you receive a referral Cooley Dickinson is affiliated with Mass General. What if there was a specialist in Boston that you wanted to go to or you got a referral? Is that allowed?
Okay, so if within HMO, you do have to seek services within our network. Yes, it's correct. The Eastern Mass hospitals and providers are not in our network. So in order for you to seek services there, you do have to get a prior authorization. So if your primary care physician or specialist here within Health New England network is recommending you seek somebody out in Eastern Mass or even out of state, a prior authorization is always required. So that is the paperwork that's submitted by your provider that's recommending you seek services outside the service area. It comes into our health services department and gets reviewed by our nurses and doctors. One of them is medical, if it's medically necessary. Second criteria would be if the service, and I see this a lot, if we have the service available within our network, we'll often redirect you to maybe UMass or Leahy. If we don't have those services in network, that's the likelihood that you get approved to go out of network.
And what would the copay be in that situation?
If it does get approved, that prior authorization gets approved, whatever services it is, let's say if it's a doctor's visit, you would pay what you would pay as if it were in network. So it would be approved out of area or out of network visit, but you would pay as if it were in network. So if it was an outpatient surgery, you would pay deductible on that in the copay for outpatient surgery if that was approved out of network.
Can I tag on to that, Linda? Similar question. I have a son that goes to the University of Lowell. He is a resident of Western Mass. If he would have had an emergency and had to go to one of the hospitals out there at Lowell or whatever else is right there, and wasn't able to get prior approval, what would happen then? Would they give some leeway for an emergency, call the next day if it was after hours, for example?
Could you hear all of that, Glenda?
I'm sorry.
Not really. It's kind of muffled a little bit. I did pick up is it emergency room visit, an ER visit out?
Yes, an emergency room visit around my son's college after hours. Do you need an approval in that case? Would the next day be okay?
Okay, so if your dependent is living or going to school outside the service area, we are an HMO, and so we actually have student dependent additional services. So it would be for like follow-up visits for an injury, behavioral health services. I think there's other services that we have to approve first for you to get follow-up care. But if your dependent is, on the HMO and outside the service area, they're covered for emergency care on an HMO.
Thank you.
Yep.
So there was a related question posted, how would a student living in Boston be covered under the family plan? So that's basically the same.
They would have emergency services. Again, I can send you, I don't think I have it inside the flyer here or in my, I have additional materials that speak to the student out of area coverage. But again, you need prior auth for that. So if they're student dependent on an HMO and they need additional services, you can call member services and ask for those additional services. Otherwise, they would be covered for emergency services only. We recommend that they would get their routine care when they get back in the service area.
Thank you. The next question posted is, can you explain HMO plan versus indemnity?
So we have an HMO plan. I believe an indemnity plan has extended coverage, but I'm not sure about what an indemnity plan is like because we don't offer it. I believe one of the other carriers has an indemnity plan, but I believe it has in and out of network services. Whereas we as an HMO just have we have to have folks stay in the service area.
So one of the plans offered by WellPoint is an indemnity plan. So if
Yes.
you go to our website later this week, you can see their recording and slides from yesterday.
Yeah.
Next
There's additional services on the indemnity plan for you.
Next question is Shriners Shriners Children's Hospital in Springfield covered?
Yes, it's a network with us.
Next question, clarification on mid-year changes to demographic information. Do the employee and a retiree email you the change information or then notify the benefits administrator?
That would all go to the GIC first. So we would have, I believe they have regular eligibility or qualifying events during the year to change plans. If you have loss of coverage, if you have marriages, all that needs to come to the GIC first, and then they trickle down the information. So what they'll do is if I got married, I would notify them that my spouse and I got married on June 1st, and I would I would like to add my new spouse onto the plan. They would then put it in their system, like enter everything in the system. We would receive the feed either on a Tuesday or Friday. And then my spouse gets added into the Health New England plan. So all that does have to come from the GIC first.
Thank you. Next question. On the online provider search for urgent care, the only locations listed are a bit far from Greenfield. Are we able to attend any urgent care even if out of network?
So not necessarily. When you're in our service area, you do have to utilize urgent care facilities in our network. When you're outside of our service area, then it's either urgent care or emergency services that are covered. So if you go to Springfield and there's an urgent care there and it's not in our network, it won't be covered because we haven't contracted with them yet.
Okay, and just to clarify, if you're traveling out of state, how about
emergency? Yes. You can seek out emergency services or urgent care facilities, and or you could, call Teladoc.
Thank you.
You're welcome.
Next question again about the dependent at college outside of the network. Do you have to contact Health New England once you join for student dependent services? What are those aside from emergency services?
Yes, they would be as needed services. So you don't necessarily have to contact Health New England if you have a student dependent. It's just that if you do have a student dependent that's living outside of our service area, then you do have to let us know if those dependents need additional services. Just looking it up right now, what those specifically are. Let's see. So for students out of area coverage, we again, you have to call our member services department to let us know that your student dependent needs these additional services. We have to get them approved. Follow-up visit after an ER or urgent care visit, non-routine medical office visit, including labs or x-rays, allergy injections, outpatient behavioral health visits, or outpatient short-term rehab services. Or again, for any routine care, then your dependent would have to come back into the service area to get that covered. Yeah, to get that scheduled in the service area.
Thank you. That's it for the online questions at the moment. So we'll open it up to folks in the room.
I'm an insulin pump user, and it's a mini net, and I use the continuous glucose monitoring system. And I use Byram Healthcare to get the durable medical equipment. Would that be the same protocol?
I apologize, sir. I didn't quite hear everything, but some feedback. I apologize.
It's about the durable medical equipment.
Yeah.
Yes. So we have a vendor called Northwood that manages our durable medical equipment. If you'd like to check on something that we do cover, I don't have a quick at a glance list. I'd have to check with Northwood. So you do have to use our durable medical equipment in-plan providers for that. So I wouldn't be able to answer this 100% as of today. If you like to send me the information, I could try to see if what our coverage is for the DME.
That was an okay. Thanks.
Oh, thank you.
Yeah. Anything new there?
Okay, next question. Are Greenfield Family Medical and Rebecca Jones Dermatologist in Whately, Mass. Covered?
I would have to look up, or I could refer them to the provider lookup. I can get back to you unless you'd like me to try to look now. Whately. Let's see. Let me just look quickly. Let's see. I'm going to first look up Rebecca. Rebecca Jones is in network with Health New England. Sorry, it took me a little bit.
Was there a second provider in that?
Yeah, I'm looking for Greenfield Family Medical. Is that the exact name? I'm not finding that one in here.
It might
Is
be
there?
Greenfield Medicine, which is
Yeah, I
Bay
saw,
State.
I think I saw that.
Is it okay? I might not be putting in the right name. Is it Greenfield?
I think it's, isn't it Bay State?
Greenfield Family
Greenfield
Medicine.
Family?
Yeah, Greenfield
Is that
Family
Bay
Medicine is
State?
Bay State. There is no Greenfield Family Medical.
But so that answers yes, they were.
Yes.
Okay.
They were
Okay.
in network.
Yeah.
Okay. Oh, I just saw a new one
No,
pop in.
it's just a thing.
Oh, it's a thank you.
You're welcome.
Okay, another one in the room.
Yes. I know that the federal government has changed their opinion about what vaccines are medically necessary. How does Health New England cover vaccines? Is that Caremark or is it CVS that manages that, or is that you all?
I believe that is, I mean, we have our preventive care covered at 100%, which includes immunizations. So I believe that would be through pharmacy if they decide to cover certain vaccines or not. Might be a question for CVS.
Thank you.
Yeah.
How do we sign up for this?
So the GIC will be emailing you a link to register and sign up probably tomorrow morning, sometime around 10 o'clock is what.
Okay, what do you do if you don't have a computer? Or don't have it? I mean,
Use a computer at a local library, or
Or you might want to ask, are you Pioneer?
yeah,
So you might want to ask them if they're setting up any kind of, session to help you enroll
someone.
Wonder if you could.
through your
go through
benefits. You'd have to
Suzanne.
talk to your benefits administrator.
okay, so I guess you said, I'm not computer literate very good, but you said I could use another computer at the library or something like that?
Senior centers.
Okay, but what would I punch in if I don't have any app? I mean,
Do you have an email address?
on my phone I do, yeah, but I never used it. I don't,
That's what Pioneer would have sent to GIC as your contact information. So you're going to have, you need to talk to the benefits
Okay, so I
administrator.
go to Pioneer?
Yes.
Okay, that's,
Yes.
I mean, because they send me everything paper trail.
They're probably expecting you.
Okay. No, I mean, I'm
Just got a new question. Are phlebotomy services covered? My daughter needs to have amounts of blood extracted on a regular basis.
So I believe that's lab work. Yes. Lab work applies towards the deductible, and then there's zero copay.
So just,
You're welcome.
I got another one just came in. If a member of Health New England with a family plan visits the emergency room and the total bill is $600, what is the out-of-pocket cost with deductible and copay?
So if a family, okay, an individual in a family plan's deductible is $400. Emergency room, is it? I believe it does apply towards the deductible, and there's a $50 copay. Let me just double check that really quick. So the member would pay $400 deductible, and they've met their deductible, and then they would have a $100 copay. Going forward with another emergency visit, you would only have a $100 copay, since your deductible of $400 met. We keep track of the individual's deductible in the family, so we don't allow one person to be responsible for the entire $800 deductible. Does that make sense?
yes.
Okay,
Thanks.
great. Sure.
And do you have an app for tracking your own deductible?
Yes, if you go onto the member portal, Claire, once you sign in with your ID number,
Yeah.
it keeps track of all your dependents as long as they're under 18. You can view all their deductible services on there for the family.
Okay, so everybody has a way to sort of know where they are in meeting that deductible for the year.
Correct. Yes, yes.
So it's pretty quiet here. We'll give the Q&A another.
I just
Oh,
need to know a little bit more information. How do I get a hold of this lady to talk about the durable medical equipment? If she can answer my questions, she doesn't.
do you use email or?
Yeah, I do, yeah.
Yeah, if you can send me exactly what it is, I can try to get confirmation as to if we cover it or not.
What do you mean, what it is? What do I use for equipment?
No, your email address. If you would just put this here and I'll put you in touch with her tomorrow.
Okay.
So I just need your full email.
Another question posted, what if my daughter is 18 years old? Is she covered?
Yes, dependents are covered till they're age 26. So the month that they turn 26, they will term off the plan. So if their birthday is September 15th, they'll be covered till September 30th.
Okay, great. Okay, so I appreciate very much your time.
No, thank
And,
you. Thank you very much for having me.
You bet. So we'll say good night. All quiet on the chat.
Have a great evening, everyone.
Thank you.
You too.
Thank you. Bye-bye.
Bye.